From the nation's capital, welcome to Your Source TV. Be empowered, encouraged, and inspired to look beyond the ordinary. From the nation's capital, welcome to Your Source TV, where you are empowered, encouraged, and inspired to look beyond. I'm Tamara Stuchlak, and in this segment, we explore integrative wellness. With us is Dr. Viet Le.
Hi.
He's a chiropractic physician. He's board certified. He is a graduate of the University of Virginia and also of Life University, a chiropractic university. Dr. Le, thank you so much for being with us.
Well, thank you for having me, Tamara.
So let's jump in, and most people think they know what chiropractic is, but let's hear it from you and your profession.
Well, chiropractic, to me, has to do a lot more than just dealing with the spine. One of the first things I've learned when I proceeded or entered chiropractic school was the philosophy behind chiropractic and what it means. It's more than just not prescribing medication. Me not knowing anything about chiropractic prior to going to school was interesting, because when I first attended college, I didn't know.
What did you study at UVA?
I studied pre-med. I was actually going on the way to becoming an allopathic medical doctor. So what led me to chiropractic was my mom actually had a very, very severe back injury. And she had tried conventional medicine, and unfortunately there was no help for her. But because I wanted to help her out, I did my research, and essentially, came upon chiropractic. And I, of course, looked up several doctors in Lynchburg, Virginia, which is where I grew up.
Physical manipulation.
Yes, physical manipulation.
Beyond surgery and drugs.
Yes, yes. At that time, it wasn't, something that I had looked into from a career path. But based on the results that my mother received, it was enlightening to me, because it actually opened up a completely different way of looking at, healthcare in general.
So what was your aha moment? What part of her treatment just caused you to? Well,
that's a great question. When you see your own mom suffering for 2 months without her pain relenting in any way, you want to do whatever you can to help, right? So you're open to a lot of things, natural things. I don't think surgery would have been an option, because at this time I didn't know, but clinically it wasn't necessary. But in speaking with several people and interviewing several chiropractors in Lynchburg, means somebody who knew nothing, I asked certain relevant questions, and they told me what they were going to do, and it made sense to me. So I essentially brought her to a chiropractor that I respected, and of course he treated her for several months, and she's completely pain-free, and she's extremely healthy, and of course I'm grateful, because my mother is feeling wonderful now.
So the beginnings of chiropractic are steeped in what traditions?
Well, it's based upon the fact that the body has an innate ability to heal. It's interesting, because you asked me about chiropractic and how it's founded. I'm going to tell you a little story about that. Chiropractic was founded by D.D. Palmer. He was a researcher. Anyhow, there was a janitor that actually helped, clean his facility at night. And apparently this janitor, his name is Harvey Lillard, apparently fell as he was working, hit his head against something, and within a couple of days, lost his hearing. Now, upon losing his hearing, he also had inflammation right around the neck region. Now, because D.D. Palmer was concerned, he wanted to know what happened, and Harvey essentially—
Root cause.
Yes. And so he examined Harvey and realized that there was some inflammation in a certain area that wasn't there prior to the accident. So in his estimation, if something happened that threw something off, why not just put it back where it needs to be and see what happens? So essentially, I don't know how he manipulated, because honestly, that's not how chiropractic has been developed, but somehow he made a difference by re-establishing the integrity of that Harvey's neck. And as the story goes, the hearing was restored. And from there, he wanted to explore that a little bit more. And over 100 years, here we are.
So what are some benefits to chiropractic that you see with your patients? And what are you working toward with them?
You know, it's interesting because a lot of patients who come to see me, they actually have, they usually suffer from pain symptoms, you know.
Chronic.
Chronic pain. It's not just chronic, acute and chronic. And we'll talk about that, by the way. But they usually suffer from some form of discomfort. And when they come in, my purpose is to understand what is causing their symptoms, and then we can go about choosing different modalities to help, whether it be chiropractic, whether it be acupuncture, whether it be some other form of treatment protocol that I think is necessary. But it's up to me to make that decision. But beyond just dealing with the chronic pain or acute pain that they're dealing with, I always try to educate my patients to understand the premise of where we're coming from, because ultimately, they will have to take care of their own well-being. And so that's my goal.
So your center has a variety of modalities, and when they come to you, you are heading up the health team to direct them best to the integrative services.
Yes, I'm directing because I feel like I'm grounded. I'm not gonna, you know, pat myself on the back for that, but I strongly believe in my own philosophy.
Which
you know,
is?
Which is what we talked about earlier, that we need to allow the body to have its innate ability to heal. We need to do something to restore that.
The body really can't heal itself.
It heals itself, but it needs help. And that's
Correct.
why we have different, you know, services there. And that's the cool thing, is being able to integrate these services.
So what part of a person's health is related to their physical component and their emotional component, and how do you see that working out for your patients and what you share with them?
Well, you know, going back to the patients, the physical manifestation of pain is quite easy. When you injure a tissue,
Easy.
for instance, yes, the understanding, it's
Yes.
easy to me, but I would like to explain in the sense that if you injure a tissue, the inflammatory processes would occur, and as a result, it actually increases your level of neurotransmitters, one of which is nociceptors. Nociceptors are pain receptors. These receptors essentially send signals, you know, where the brain can interpret it as pain, right? So from a physical perspective, you've got these changes that are occurring at the damaged area. So your brain interprets that as pain, and as a result, then that gives us clues as to where the pain symptoms are coming from. Now, how does that interrelate with the mental aspects? Well, pain itself is a good thing because it prevents us from continuing to harm ourselves. However, if it's too much pain, if it's intractable pain, then you've got to do something to help it along. And if you're suffering from pain on a continual basis, then of course it's going to take a toll on you. Nobody wants to live in a state of pain, but a lot of people do.
So what are some misconceptions about chiropractic?
Well, the misconception is that we only deal with the spine. We only focus on adjusting lower back pain, neck pain, mid-back pain. And it's not necessarily a bad misconception. I just think it's too narrow-minded. Yes, it's a very narrow-minded way of thinking. And that's why I created, you know, this center, particularly with that in mind. I want for people to understand the premise behind their own body's innate ability to heal. And that it has far-reaching effects beyond just the spine. Now, the reason why, as a chiropractor, I focus on the spine is because I understand the flow. Your brain, your spinal cord has to have some form of communication. And if, you know, if there's any bridge in that communication, then of course that's where, you know, you're going to have problems.
So as this segment is coming to a close and we'll be going to break, what would consumers need to know about the uniqueness of your center? Because you have broadened your practice to include integrative. So what does that mean for the consumer?
Well, what it means is when they come to see us, we're not going to just treat their symptoms. We're going to treat them as individuals who need help. And if a person comes in to see me and they have no clue why they're hurting, it's up to me to identify those. And a lot of times, it may not even be the area of where they're suffering from. It could be coming from somewhere else. And if I'm able to somehow identify these things and also direct them to services that would help treat it.
Or to other physicians.
Or to other physicians, absolutely.
Yes.
I work very closely with medical doctors. Gosh, you know, some of my best friends are MDs. So it has nothing to do with just keeping it within my center. It has everything to do with actually allowing the patient to know that when they come into a place like ours, that they are going to be treated holistically. But it's going to be something that will allow them to feel like they can heal.
So would you say that there's a distinction between coming into sort of your model of an integrative center that includes chiropractic and other modalities, that there's more than drugs, there's more than surgery, there's more than psychosocial services. So can you explain that a little bit more, or give an example of a patient that might receive 2 or 3 modalities?
Well, let's put it this way. I have several patients who come into my office and they have cancer. So what do you do with that? Terminal cancer, right? They're in severe physical pain. They're in constant pain. And beyond that, they also
the
have
morphine really isn't working anymore.
No, the morphine's not working. On top of that, too, you know, in their minds, they don't have that much longer to live. So how do you help them? Do you just treat their pain? Or do you talk to them as a human being so that there could be something else, you know, for them to hold on to? And by no means am I saying that, you know, this is a place where cancer patients can come and feel better because it's for everyone, right? But if someone comes in and they don't know if there's anything else that they can do, then we're there to help. And having the services there allows them to, you know, to get the assistance that they need.
So what might be a couple services that maybe perhaps would surprise people for those types of patients, or others that would sort of round out a person's care that they wouldn't necessarily see, you know, in a conventional medical protocol?
Right. You know, in our office we have acupuncture. And acupuncture is fantastic in dealing with pain symptoms. You can modulate pain through, of course, stimulation of certain meridians, or through needle acupuncture. But nonetheless, that's a way that patients can utilize, you know, something new and different.
So, Dr. Lee, we're going to go to break now, and we will continue. So
Okay.
please join us after the break. Your Source TV. Welcome back to Your Source TV. We're here with Dr. Lee, and we're talking about the field of chiropractic and your concept, which embraces an integrative wellness center. So, Dr. Lee, what benefits do patients see in your practice that incorporates your philosophy and all of the modalities that are possible in your center?
Well, to answer, it's kind of like a convoluted question because there's a couple of different ways to answer it. The first one is it's integrative. It's integrative because I'm trying to essentially bridge Eastern medicine or Eastern philosophy with a Western philosophy. And with that in mind, that actually helps, you know, gives patients a lot of options. Now, as far as the services that we render, we have, of course, acupuncture, we have medical weight loss and nutritional management, of course, the chiropractic. We have anti-aging and restorative functional medicine. So these are things that patients can.
You have an entire team of.
Yes, we have a massage therapist on staff as well, and of course, folks that help.
So what conditions respond best to chiropractic and perhaps others that you've seen in your practice?
Any conditions that have to do with a neuromuscular aspect, you know, respond best to chiropractic. Any biomechanical type of dysfunctions respond extremely well to chiropractic.
Slip and falls.
Right.
Chronic pain.
Right.
Sitting improperly at your computer.
Well, for instance, let's say if you had neck pain, right? And you didn't know where the neck pain was coming from because you've never sustained a fall, right? But yet you have this pain. Or you wake up with neck pain. You don't know why, but you still have this pain. But bottom line is this: if you come in, you don't know where, it's up to me to understand where it's coming from. And that's why we do orthopedic tests. That's why we do the examinations to rule out certain things. And a lot of times we find that everything traces back to the spine. Because if you have any sort of, again, issues in the extremities, and you feel the pain in the extremities, in the hands and what have you, for instance, numbness, then that can be traced back based on the nerve pathway that, of course, goes from the hand all the way up into the neck, into the brain, and then vice versa.
And then there's spinal decompression therapy.
Yes. Spinal decompression therapy is designed to help folks who suffer from spinal stenosis, who suffer from degenerative disc, who suffer from bulging disc or herniated discs. Most people assume that if they have any of those particular conditions, that surgery is the only option. My belief in that is that surgery should be the last option. Not that it's not necessary for folks, but it should be the last option. But spinal decompression is
like you've tried everything else, like a whole series of chiropractic and other modalities.
Yes, I mean, chiropractic is important because you have to understand why, for instance, a disc is degenerating in the first place. Okay, and a lot of times it points back to the biomechanics of things. Your body is designed to hold you up, right? When we're born, we're born with hopefully everything being symmetrical, left and right, and the shape of the bones should be, the way that they are, perfect, right? Now, if the way I look at patients when they come in is, are there things that they are suffering from, which of course that's why they're there, but also I also pay attention to the way they walk. I pay attention to how they sit. I pay attention to whether they have a head tilt, because I'm paying attention to the biomechanical things that they're not aware of. So it's important for me to recognize these things so that we can figure out whether it's something that is relating to the spine, so that we can do something to help them.
So how do your patients track their progress? So you are supplying information into a medical record, but how do you see that people really value their change in health status?
One of the first things that patients need to understand when they work with me is that I'm there to help them. I'm not there to hold their hands. They have to essentially hold themselves accountable for their own success. After a diagnosis, we can essentially treat them based on the treatment plan. But of course, everybody has expectations. But beyond that, right, then they need to, of course, manage their condition outside of the office. When they come and see me and they get treated for an hour or two, what happens to them, for the 23 hours that they're not there with me? Well, the way that they chart the progress is to do things that we recommend and ultimately, see how they feel throughout. And it's important because, these folks who do follow our treatment plans thoroughly do get well. They feel better. They're able to sleep better. They're able to manage their symptoms much better. And their overall well-being has improved or will improve.
And in many cases, you have addressed the root cause.
Of course. It's always the purpose is to address the root cause.
So how do you respond to the perception and the commentary on chiropractic that, oh, once you go, you'll be there for many, many visits? Why? What's that question all about?
Well, I think the reason why people feel that way is because there's a treatment plan required in order to make a change in something.
To have the body heal itself.
Right. Well, in order to make a biomechanical change, you have to slowly adjust it so that your body can accommodate. Your body has the ability to accommodate for all sorts of changes. That's how we're able to endure the rigors of our environment. Right? So if I'm able to go in and adjust you, I'm actually working against you, okay, when you're in a state of dysfunction. But as I continue to correct, then your body will ultimately know what to do in order to help stabilize your condition. And that takes time. And if they need to come in for sessions, multiple sessions, it's designed to allow for that stability to occur. So most people have no problems going to a physical therapist, for instance, when they're trying to rehab a certain condition, 3 to 4 times a week for a series of months. Well, the same sort of principles apply. It's done so in order to allow things to stabilize. Now, beyond that, right, then it's a choice that they have to make. And that's what I want my patients to understand, is that if they have a choice to be well or continue to go down the road that led them to be not feeling so well, then it's up to them. Okay? And we would, of course, educate them so that they can stay well.
And how do you bridge conventional with integrative health? What is that philosophy that you incorporate?
Okay. My philosophy overall is to make sure that philosophically we want to increase the body's ability to heal. That's always the principle behind what I do. So from an Eastern medicine perspective, that's how it's approached. There's a certain balance that your body has to have in order to achieve what we call homeostasis. For me, I want patients to understand that when they're coming in to see, me, we're doing what we can to increase their body's ability to heal and try to achieve homeostasis.
So when a patient comes in and has their thought, very natural thought, fix my back, what will they experience through, working with you and your center?
To fix their spine? Well, everything begins with a diagnosis. If there are things relevant to their condition, and I know it's pertaining to their lower back pain, then it's going to be easy for us to be able to remedy those. And we have the facility and the means to help. But an integrative center is more than just about your back pain. It's more than just about neck pain. It's about overall wellness. And if patients really want to go beyond that, then that's the approach that they would have with me.
What is your vision for health, and as you move forward into having a resource for patients to have integrative medicine, perhaps a new concept for some?
Well, I think there's a certain level of respect that people need to understand for themselves. There are so many different components to wellness. The 5 most important components for me to educate my patients is that they have to have balance in nutrition, they have to have balance in appropriate level of exercise, they have to have a positive mental attitude, they have to have chiropractic. And what I mean by chiropractic in general is not about the spine, but about allowing the body's potential to heal through fixing the conduit, the structural integrity of that. And of course, being able to get appropriate sleep. That's important too.
And what are your goals for the future?
My goal is to affect every single patient that comes in to see me so that they can understand what it is to be well. Most people, again, come in because they're hurting. But I would hope that in seeing me, they would understand that it's more than just the pain that we're trying to fix. It's a way for them to get educated so that they can take better care of themselves, of course. Now, the facilities that we provide, we're there to help, and we can manage their symptoms and their pain conditions. But my primary goal is to make sure that they do whatever they can to stay well. I would be very, very happy if I saw a patient once every year or so because they just need a tune-up, versus having somebody come in, and see me for an entire year because they're suffering from pain. That's not our goal.
Is there a case or a condition that you've treated that sort of surprised you and gave you an aha moment or was particularly challenging?
Yeah, actually, that aha moment pertains to me, actually, because when I first received my first adjustment, it was so profound, I had no clue what was going to happen.
In what way was it profound?
It was profound because I had been suffering from severe sinusitis for 4 years. It didn't matter the season, but it was one of those things where I just had constant head congestion. And when I received my first adjustment, the doctor at that time told me just to go ahead and lay there and enjoy it. And I didn't know what he meant by that, but he said just close your eyes and allow your body to flow, allow your chi to flow. And I did. I laid there, and all of a sudden, I can feel my sinuses open up. I can feel that there was a certain level of clarity that was released.
A natural state.
A natural state. It was one of those amazing moments, because when I got up after 30 minutes of laying there, not knowing what the heck just happened, I stood up rejuvenated. Now,
does it matter that we know what happened or that it just happened?
Of course it matters, but the fact that it happened there has to be some sort of respect for that. So there's something there, right?
So as we're coming to a close, what final thoughts would you like to share about what's possible for patients?
Well, as a healer, I would want patients to have trust in the folks that they're working with.